Hi, my name is Marcia Snow and I'm a speech language pathologist with health-related home care. And today we're going to talk to you about the anatomy of your swallowing. There are 3 stages of the swallowing mechanism: the oral stage, the pharyngeal stage, and the esophageal stage. Now, swallowing is a very complicated process, so we're going to draw a diagram for you to show you exactly what happens when you swallow. First, you're going to see the roof of the mouth with a bone above it. It's called a hard palate. Now, if you look in the back of your mouth, when you look in the mirror, you're going to see a little dangly part at the back of your mouth. That's your uvula and your soft palate. Above your mouth, you also have very extensive nasal passages. Along the base of your mouth is your tongue. If you go down from there, you have your larynx, or what we frequently call our Adam's apple. The larynx and the trachea are very close to the front of your neck. Your larynx is a hard cartilage that contains your vocal cords that vibrate to make your voice. The larynx is continuous with the trachea, and it consists of cartilage. And immediately behind the larynx and the trachea is the esophagus. That's the tube that goes to your stomach. So you can see that the tube that goes to your stomach and the trachea, the tube that goes to your lungs, are side by side in your throat. Now, in real life, the esophagus is closed and only opens when food and liquid go through it. It's like a muscular chute. But for the purposes of this diagram, we've made it look open so you can see better. The top of the larynx is the top of the airway. If you look down into the top of the larynx, you'll see a hole opening into the trachea. That's called your glottis. Over this opening is your epiglottis. Many people refer to that as their flapper. Most of the time when you're breathing, your epiglottis stays open and up. So the hole is open because that's the only way you're going to get air in and out of your lungs. Okay, so let's review. We have soft, flexible parts, which are your tongue, your soft palate. That's very flexible, and it's continuous with your hard palate, which is rigid. That's the bony part. The epiglottis is made largely of cartilage, but it can flap up and it can flap down. So let's think about the first stage, the oral stage. Food goes into your mouth, and that starts the process of chewing. The sides of your mouth and your tongue are involved in controlling the food in order to chew. Saliva also mixes with the food so it can be moistened and more easily swallowed. They all work together to form a bolus, or a ball of food. The tongue presses the bolus of food against your hard palate to move it back in your mouth. So we see this area in the back. It's called the pharynx. We see the nasal passages, and behind the nasal passages is the nasopharynx. Behind the mouth is the oropharynx. And at the level of the larynx is the laryngopharynx. So your tongue forms the bolus of food, and then your tongue rises and moves the food back and goes through to the oropharynx at the back of your throat. Now, the process of moving food from your mouth into the oropharynx is a very voluntary process. You're controlling that. But after it gets to the oropharynx, that process becomes an autonomic process, which is controlled by your autonomic nervous system. In other words, it's an involuntary process. Your body takes over at that point. The next thing that happens is that the food needs to go from the oropharynx into the top of the esophagus. This is the beginning of the pharyngeal phase of the swallow. Now, we don't want the food to go back into the mouth or up into your nasal cavities. And we certainly don't want the food to go down into the airway because that would cause choking, an inability to breathe, and aspiration into your lungs. Now the autonomic system takes completely over. The pharyngeal phase is an autonomic phase, and several things happen in this phase. First of all, you're going to have to stop breathing because you don't want to suck food into your trachea. Just to be safe, the vocal cords are going to close off as well. So when you swallow, you won't be breathing or talking. And by the way, the most common cause of choking is talking and swallowing at the same time. To stop food from going back up into the nasal passages, the soft palate must move from this position to this position. This will stop the food from going back up. Also at this stage, at the same time, the tongue goes up and back to eliminate any possibility of any food from the oropharynx coming back into the mouth. So now, nasal cavity and the oral cavity are both blocked off. At the same time, your larynx moves up, and at the same time, the epiglottis moves down to protect the airway. It covers up the top of the airway. So the only way that's left for the food to go is down into the esophagus. To facilitate this, the walls of the pharynx will constrict to move the food down into the esophagus. Now the top of the esophagus is normally closed off, so what has to happen now is for the opening is for it to open so the bolus can go down into the esophageal phase of the swallow. At the top of the esophagus is a muscle band. As the bolus of food approaches the pharynx, the top of the esophagus has to dilate and relax to open. The bolus is propelled down the esophagus by waves of contraction. This moves down through the esophagus, through the lower esophageal sphincter, which has to relax to go into the stomach. So there you go. You've got the first stage, the oral stage, the second stage, the pharyngeal stage, and the third stage, the esophageal stage. As you can see, this is a very complicated process. Safe swallowing can be compromised for many different reasons. If you or anyone else that you know have difficulty swallowing, talk to your physician about having an evaluation from a speech language pathologist.